Del Bailey. Good morning. I'll be talking today about the human health impacts of a changing climate in Maine. My co-author, Susan Elias, and I were tasked with considering the wide range of possible health impacts from a changing climate in Maine. And we focused our portion of the Phase 1 report on those impacts that we think are likely to affect us here in Maine. Specifically, those are exposure to extreme temperatures, extreme storms, and vector-borne diseases, and food and waterborne illnesses and poor air quality related to ecosystem effects of climate change, as well as indirect downstream impacts of a changing climate on mental health impacts. For the purposes of this talk, I'll be focusing on those shown in red: exposure to extreme heat, extreme storms, and vector-borne diseases. I'll also spend a bit of time considering those impacts that we think are difficult to measure but may be considered high risk in Maine when we are able to learn more about them, and those in specific are air quality or pollen exposures and mental health impacts. So I'm going to talk first about the most obvious and direct impacts of climate change on human health: extreme heat. Heat is the leading weather-related cause of death in the United States. We see currently an average of more than 600 heat-related deaths per year. And in addition, we know that heat waves can cause extreme mortality and morbidity events in addition to these background cases of about 600 or more heat-related deaths per year. Examples of those include the 1995 heat wave in Chicago, which is estimated to have caused around 700 excess deaths during that heat event period. And the fairly well-known European heat wave of 2003, which is estimated to have caused more than 40,000 excess deaths in that region over the course of about a month in 2003. Now, we think of our climate in Maine as cooler than these places, but in fact, we have in the past seen extreme heat events of this type. The entire New England region experienced an extreme heat event in 1911, which was a period where the temperatures were in the 90s and hundreds for an 11-day stretch in July, with a high temperature of 106 degrees in Bangor. And it is estimated that across the New England region, there were at least 2,000 excess deaths that were directly related to that that extreme heat event. So these events, while rare in Maine, are certainly not unprecedented. It's important also to remember that Mainers are vulnerable to these extreme heat events, in part because we are not used to them. We're physiologically not well adapted to extreme heat because our bodies don't experience it very often. In addition, our population is older. We have high rates of chronic diseases such as asthma in the state. We have a high proportion of the population living in rural areas and engaged in outdoor occupations. And we know all of these are risk factors for heat-related illnesses. In addition, our homes, as well as our businesses, schools, and institutions like elder care facilities, are often not air-conditioned. These buildings are built to keep the heat in the winter and not keep it out in the summer. And this puts people that live, study, and work in these buildings at risk in hot weather. So the map on the right shows county-level rates of home air conditioning across the state. We see a low that ranges from about 25% in Hancock County of homes with an air conditioner to about 70% of homes in York County. And the state average is about 50% of homes with air conditioning. This compares to about 85% or more of homes in the Northeast region and the rest of the United States. So it's clear that even as compared to our nearest neighbors in a cool region, we're somewhat unusual. So although we do enjoy a relatively cool climate compared to other parts of the country and the world, as you heard from Sean earlier, heat has been increasing in Maine in recent decades and is predicted to continue increasing. This map on the right is a set of predictions done by Sean and the Climate Change Institute showing the likely change in the number of extremely hot days between the 2000s and the 2050s. This is the number of expected days with a heat index, which is a combination of temperature and humidity that gives you a better sense of how hot it feels. And what you can see is that those are expected to increase by 2 to 4-fold from the 2000s to the 2050s. And what that means in practice for places like Sanford, Portland, and Lewiston, Auburn is about 2 weeks of extremely hot weather that we would consider dangerous to health every summer. And of course, as the climate warms in the state, without any further adaptations, we can expect that heat-related illnesses and deaths will also increase. Just illustrating that increase, with apologies for the low resolution. This is a figure from a study we did at the Maine Center for Disease Control, along with colleagues in New Hampshire and Rhode Island at the health departments there, as well as Brown University, showing the relationship between the daily maximum heat index and the daily number of emergency department visits for any reason across the region. So this is not just heat-related illnesses, but exacerbations of asthma, heart attacks, other kidney failure, other types of health effects that we know can be exacerbated by exposure to heat as well. And what we see is a very clear increasing relationship with hot days and emergency department visits for any reason. So if we were to compare a day in the region where the heat index was 95 to a more moderate day where the heat index is only 75, we would see about a 7% increase in emergency department visits for any reason in this region. One thing I want to point out, the black line in the center is our regional average, but the purple line for Maine really diverges upwards in the hot temperatures from the rest of the region. And so for that same 95-degree day in Maine, we would see about an 11% increase in emergency department visits for any reason compared to a more moderately warm day. And that just really illustrates that even in the Northeast region, we are uniquely vulnerable. I want to move on to the next direct impact of climate change on health that we considered, and that is extreme storms, specific flooding. Floods can, of course, be caused by extreme precipitation events as well as extreme storm surge in coastal areas. And these flooding events can lead to traumatic injuries and deaths, as well as waterborne disease outbreaks, diseases like cryptosporidiosis and giardiasis. And in addition, downstream effects of displacement and loss can cause mental health impacts that we'll discuss in more detail later. These extreme precipitation events, as you've heard, have increased over the past few decades in Maine and in our region, and are predicted to continue increasing. Extreme storms as well have increased in the latter half of the 2000s, but just in talking with Sean earlier, it's not entirely clear yet, I think, whether we can expect these trends in extreme storms to increase, although given what we understand about the climate drivers of those storms, it's probably likely. I want to take just a moment and step aside and explain a little bit more detail how waterborne illnesses can be related back to extreme precipitation events. The other health effects that come from extreme precipitation and flooding are fairly direct and obvious, but this one is not. So in urban areas where infrastructure is older and where sewer systems are combined with stormwater discharge, these extreme precipitation events can cause stormwater effluent to be mixed with untreated waste or sewage and discharged directly into surface water bodies. This is called a combined sewer overflow, and if the surface water body is a drinking water source or a place where recreational activities like swimming or commercial activities like shellfishing are conducted, people can be exposed to this untreated waste and fall ill. In addition, in rural areas, we're concerned about floodwaters inundating wellheads in private well settings and causing illness in that way. And the most obvious example of this type of outbreak is a really severe outbreak that occurred in 1993 in Milwaukee. More than 40,000 people were sickened and 54 people died following an outbreak of cryptosporidiosis, which is a severe gastrointestinal disease. This occurred following the heaviest rainfall in 50 years in that region, which washed farm waste and caused a combined sewer overflow in Milwaukee. And this wastewater was discharged right outside of the intake area for the city's drinking water system. So this is something, this is a very severe example of something that certainly is a possibility in Maine, given our older infrastructure in some of our cities and towns. Of course, we're also concerned about the health effects of other types of extreme weather events. Winter storms and windstorms, in particular, of the type that we've experienced in the last few years, can be dangerous. There can be direct health impacts, such as traumatic injuries or deaths associated with those events. But widespread power outages can also cause carbon monoxide poisoning as a result of improper generator use, foodborne illness from consumption of spoiled food, effects on healthcare access, as well as healthcare infrastructure, and of course effects on people that rely on power at home for medical devices. And finally, the displacement and loss of property and community and general disruption can lead to downstream mental health effects. So again, it's unclear whether this type of storm will continue to increase in the future, but it seems safe to assume that we can expect to see at least the same amount, if not more. Another really important impact of a changing climate on health in Maine is the spread of vector-borne diseases throughout the state. Tick-borne diseases are increasing exponentially in Maine and have been for the last decade or so. Lyme disease, anaplasmosis, and babesiosis, as well as the less common but extremely severe Powassan virus, can be transmitted by the deer tick. And we expect, given that conditions for the deer tick are continuing to be favorable and favorability is increasing in Maine, we think these diseases are likely to continue increasing. Of course, everyone in this room, I would assume, knows that the health impacts of these diseases can be severe. So a changing climate in Maine means warmer, shorter winters and more humidity, and these will allow tick populations to overwinter more successfully and to spread into further areas of the state. The maps on the right here are showing favorable conditions for ticks in brown and unfavorable conditions. This is for the deer tick specifically in blue. And what you can see is past conditions on the left and current conditions in the center. Climate conditions were really acting as a brake on the spread of the deer tick throughout the northern and westernmost parts of the state, although you can certainly see the change from the 1980s to today. What's also clear is that projections suggest that this climate break on deer tick populations will be almost completely gone by the 2040s. It's important, of course, to remember that climate is not the only driver of these changes in vector-borne disease patterns. There are other factors at play, such as suburbanization and increase in deer populations across the state that we need to consider. But whatever the cause, we also need to be thinking about the incursion of new vector-borne diseases into the state, as well as the spread of vector-borne diseases that we already experience. And vector-borne disease ecologists in Maine in particular are concerned about the likely arrival in the next coming years of the Lone Star tick, which can carry ehrlichiosis, which is a similar disease to anaplasmosis and Lyme, as well as the alpha-gal or red meat allergy, which has gotten a lot of press lately. And finally, I want to cover a couple of impacts that we have concerns about as potential emerging health impacts, but which we have relatively sparse data to evaluate. One of those is pollen. We know that warmer weather, in particular earlier springs, warmer temperatures, as well as increasing atmospheric carbon dioxide can lead to increased pollen production in plants and increased pollen seasons, and this in turn can lead to an increase in allergic diseases such as hay fever and asthma. We already have high rates of those diseases in Maine and in the Northeast. And at previous points in the past decades, we have had as many as 3 pollen monitoring stations around the state, but unfortunately none of those are currently active. So this is a place where we really have a limited ability to understand the current effects and exposures, as well as make any conclusions about how they are changing in a warming climate. Finally, I want to talk about one of the most difficult to measure and potentially profound impacts of a changing climate on health, and that's mental health impacts. As I've talked about a few times here, there are a lot of downstream ways in which mental health can be impacted by other impacts of a changing climate, but this is very difficult to measure. So in particular, we know that exposure to extreme weather events, such as storms and flooding, as well as extreme weather, winter weather storms, can cause significant mental health impacts ranging from anxiety, depression, post-traumatic stress disorder to suicidality. These have been well documented in communities like those that survived Superstorm Sandy and Hurricane Katrina. We also know that exposure to extreme heat is associated with significant mental health impacts, and these range from the more moderate things like reduced cognitive performance to really profound and significant effects such as increases in aggression and violence, as well as suicide. These are well documented in the literature, but difficult to measure in aggregate across an entire state, for example. And finally, those with existing mental illnesses are vulnerable to a wide range of climate impacts and exposures. So for example, populations have limited resilience and limited ability to protect themselves from extreme storms or other climate-related exposures. These populations are more likely to experience social isolation and to experience homelessness, which of course is a really produces a really profound inability to protect oneself from extreme weather of any kind. And furthermore, medications taken by people with mental illnesses, in particular psychoactive medications, can really significantly impact the body's ability to regulate temperature, and that puts those people at extremely high risk for heat-related illnesses when the weather is hot. So it's clear that this is a really complex set of effects that have linked vulnerabilities and impacts, but in turn are very, very hard to measure across a population. So this is something that we want to continue looking at. It is an important piece of the puzzle of climate effects in the state of Maine. Thank you.